Okay, thank you. Hi everybody, we're starting this talk with a brief introduction on if you want to access sign language interpreter for this session. So the whole session will be BSL interpreted by Christine. So if you would like to access the BSL interpreting, then if you hover over Christine's video, who's the BSL interpreter, you should get 3 little dots, and then you can press pin participant. That means her video should stay up throughout the presentation and should come next to the slides. And if you would like to access captions, subtitles, which seem to be working very well generally for us, then at the bottom of this presentation you should see this little black which has CC for captions. So if you just click that, it should automatically come up with captions, and you can drag them around. You can drag them around as you go as well, and they will also be reviewed after this as well. If as we go through you're having any issue accessing the communication support, then please do just write on the chat, and then we can see what we can do about that. Okay, so I'm going to get started just by way of introduction, but those instructions will also be on my first couple of slides if you have any issues as well. So thank you so much for joining this session. Why do we need deaf insight in palliative care? My name is Natasha Wilcock. I'm a hospital doctor in London, and I'm also myself. I also run an organisation called IDA, which aims to improve the outcomes and experiences of deaf people within healthcare. So with those two things coming together, then we're going to look at deaf insight within palliative care today. So the things that we are going to cover within the session, we're going to think about what deaf insight actually is and why it's so important. We're going to some real life examples of what it's like for deaf people interacting with services. We're going to do a bit of a quiz, a poll, to understand the language and around deafness. I'm going to give you some real life tips and tricks about communication skills of deaf people. We're going to think specifically about the needs of deaf people within palliative care. And then this is a huge, huge subject which I could talk about for weeks and years. So I'm going to signpost you to where to find out more. I'm going to answer some of your questions. So as we go through, please just ping the chat, then I will go through them at the end. So to start then, I've talked about this subject, deaf insight, a lot in the title of my talk, but we're going to think why we need that and what deaf insight actually is. So you might have heard of something called deaf awareness before, which is having a general awareness of the communication needs and the cultural needs of deaf people. I prefer the term deaf insight because I think that we need to go beyond simple awareness, but actually to have insight to the experiences and the needs of deaf people. And I've used the word deaf a lot. I use deaf to describe any person with any level of hearing loss. So any level of hearing loss at all, and that can be culturally and appropriately used to describe any person with any level of hearing loss. So here in the UK, 1 in 4 adults are deaf. That represents 80% of these. Represents a huge, huge proportion of the healthcare population, but particularly within palliative care, that represents a very large proportion of our patients. We have a legal need to provide deaf insight and accessible care for deaf people. So the Equality Act 2010 says that all people with communication support needs and disabilities have a right to access within public services. We are a multi-professional group within palliative care, doctors, nurses, and other professionals, but all of our professional bodies say that we must accessible care for people with disabilities and deaf people. And we also have an ethical need for insight. We know that it is essential that we are providing accessible care for every background. And we know that generally deaf is not a subject that is taught to professionals within in healthcare more widely and also within palliative care. That means that generally there is poor professional deaf insight, which leads to poor patient access and therefore poor. And the other thing to say is that I'm talking a lot about patients here, but also there are other deaf people within our service, so deaf relatives and others who are around the patients, and also colleagues too. So having good deaf insight and accessibility for deaf people benefits everybody, including us. So hopefully I've convinced you to learn about. We're just going to look at a couple of videos here, very, very brief videos about the experiences of deaf people within healthcare. These videos intentionally have no sound. Okay. Going to look at a second video. They were just two brief vids created by a charity called Sign Health, which does a lot of advocacy for deaf people within healthcare settings, and just showed a couple of really simple examples of where things have gone wrong for deaf people within healthcare settings. And I want to just talk about this real life case as well, which was a case which happened in 2023 with this deaf family. So this lady's husband sadly died at home of a sudden cardiac arrest. And when the paramedics arrived and they tried to resuscitate him, but unfortunately were unable to. When she then arrived home, they were unable to communicate with her. Her first language was British Sign Language, and they were unable to communicate with her what had happened before her husband dying, and were sadly unable to communicate that he had died and that they had tried unsuccessfully to resuscitate him. The way that she ended up finding out all of this was that she had to call one of her colleagues. She worked in a deaf school, who then had to interpret that conversation with her. That obviously had a huge impact on her emotionally at the time, on her wider family, also on her subsequent grief. So these are just three brief but real examples of how difficult the real experiences for deaf people within healthcare settings, and just shows that lack of insight and why it's certain that we need to understand what the needs of deaf people are and make sure that we are providing them with accessible care. So we're going to do a bit of a quiz now to a bit more about deaf insight and some communication, and also some of the kind of language around culture. So how this is going is I am going to show a set of questions, and then I'm going to read them out, and then Izzy is going to kindly open a poll, and then you can vote what you think the right answers are. There are two correct answers for each one. So first of the quiz questions is, which of these statements, of the following statements, is accurate from the perspective of social model of disability? So A, people are by their impairments or differences. B, model of disability considers how to remove barriers that restrict the life choices of disabled people. C, deafness is a condition that requires treatment. And D, the way society is organised disables people. So she's going to open that poll. I'll give kind of 30 seconds or so to answer, and then she's going to tell me what were the kind of highest scoring answers.
Okay, I'm going to close the poll now, so hopefully everyone's had a chance to vote.
Right, thanks, Izzy.
So we had 44% say the way society is organised disabled people, and we've had 33 say it considers how to remove barriers that restrict life choices of disabled people, and we've had 22 people vote for people are disabled by their impairment/differences.
Okay, great, thank you so much, Izzy. So that's really good and how to explain the answers here. And what we're thinking about here is the social model of disability, which is the model that the NHS and healthcare systems should be following, and charities like Marie Curie and also Hospice UK, all people like that. So we're right that the social model of disability says that it is the way society is organised that disables people, and the model itself considers how we can restrict the life choices of disabled people. And then the opposite side of that, because there are two main disability, is the social model, which we've just talked about, and then there is the medical model, which is an outdated model, which is no longer used, that people are disabled by their impairments or differences, and therefore a difference like death would be within the medical model a condition that required treatment. But as we say, we are rejecting that medical model and thinking about the social model is the way that society is organised and societal structures, which are the things people. And I want us to really keep this in mind as we go through the rest of our talk, and also as we start to act on our own experiences as people who work within palliative care, to make sure that we're really living out the social model and making sure we're not acting within the medical model. So the next question is thinking about language. So what is a culture appropriate way to describe a person with hearing loss? And there are 5 potential answers here. So A, deaf, B, hearing impaired, C, hard of hearing, D, deaf mute, and E, dumb. So there are 2 correct answers here. I'll just let Izzy open the poll, and again we'll just have 30 seconds or so, and then she'll let me know which answers scored most.
So I'm going to close the poll now. Unfortunately, on this one, you can only vote for one, so that'll be an interesting result. But let's see if everyone got one of the 2 answers correct. So we had the most voting for hearing impaired, 50% of people voted for that. 41% of people voted for deaf, and then 8% of people voted for hard of hearing.
Great, thanks so much, Izzy. This is always a really, really interesting question. I do Deaf Insight teaching in different healthcare spaces, and I think this is the question that causes the biggest split in answers. I really encourage you, as I've once I've explained this, if you've got questions about it, just to put in the chat. So you guys answered in the way that I would generally expect. It's often an interesting thing because deaf is in the middle of my talk, and I have used it lots and lots, but deaf is often a word that people feel worried about using, particularly in the past. It was often used as a slur or as an insult, or was a word that was only used to describe someone with a profound hearing loss. So if we think about the right answers then, and I said right at the start of my talk that deaf was a word that could be used culturally and appropriately to describe any person with any level of hearing loss. For deaf, it is one of the correct answers there. And if we think, I'm glad to see not many people or no people the answers D and E, deaf and deaf and dumb, which are very offensive terms, which are rooted in very negative views around deaf people, particularly deaf people who are sign language users. But what I would say about that language is that is language I hear used within the NHS and within healthcare settings. And I have certainly had that language as a deaf doctor used against me. So I would encourage you, if you hear language being used, to call it out and explain that it is based on around people who are sign language users. So let's think about B and C. You're all thinking, you've said there are two correct answers, which one is it? So if we go to our medical and social models of disability, we said that the social model says that, and that's a model we should be. Social model says that the way society is organized enables people. It's not a problem with people's kind of individual impairment. Then hearing impaired is not a culturally appropriate term. It says that someone has an impairment. Impairment says that that is something that kind of needs to be fixed by medicine. That is an outdated term that belongs with the medical model of disability. There are a lot of deaf people, particularly, who do not see themselves as having an impairment, but see their deafness as part of their culture or identity. So hearing impaired is an outdated term which is not culturally appropriate. Hard of hearing is an appropriate term which can be used and is often particularly used for people with age-related hearing loss. I'm going to put a bit of caveat in here about language, because someone's right to use language about themselves is their own personal right. It may be that patients or even perhaps yourselves who say that they don't want to use the term deaf or hard of hearing, and that hearing is like the right term for them. That is absolutely okay. But what I am saying is that more widely, impaired is a term which can be seen as culturally inappropriate by some people. Therefore, we should be moving away from using it. Okay. So hopefully that makes sense to people. So again, those correct answers, culturally appropriate terms to describe a person with hearing loss are deaf and hard of hearing. If you've got questions or you want more clarity on that, please put them in the chat. I expect for lots of you, hearing impaired is the most common language seen within healthcare settings, in patients' notes and things like that, and that's definitely the same for me. That's definitely what I see the most. So we're going to have a last question about British Sign Language. So this question is, what is British Sign Language? BSL, being interpreted by Christine today with thanks. So essential answers here. So A, the sign language used by deaf people worldwide. B, a signed form of English. C, a language capable of expressing any abstract idea. D, a language incorporating a lot of mime. E, a language utilizing picture-like images to express concepts. F, a language utilizing space and movement to convey meaning. So what you think there is he's just going to open the poll for me and then let me know what you guys thought.
So I'm just going to close the poll now. Hopefully that's enough time for everyone. Okay, so the highest voted answer was 39% assigned form of English. The second highest voted answer was a language utilizing space and movement to convey meaning. And the kind of joint places after that was the sign language used by deaf people worldwide, and a language capable of expressing any abstract idea. And then there was, I think, maybe one vote for one of the other answers, but overall people are voting a signed form of English.
Thanks so much, Izzy, that's really helpful. So what we're going to do is just go through each answer in turn, and these are all kind of deliberately written just to talk about some very common misconceptions around British Sign Language. So if we start at the top, so British Sign Language is the sign language used by most sign language users in the UK, but every country and area has its own sign language. So for example, American Sign Language is the most predominant and common sign language used in the US. So just like spoken languages, there are different sign languages all over the world. BSL is not the predominant sign language used by deaf people worldwide. There are different sign languages used by different people all across the world. And those signs are very different within themselves and in between each other, because they have developed naturally that spoken languages have. So an easy example to illustrate this is that when you spell the alphabet in British Sign Language, you do this with 2 hands, and in American Sign Language, you finger spell on 1 hand. So I have a pretty good understanding of BSL, but if someone was signing BSL, I wouldn't have a good understanding of the signs, so they are very different. So if we think about the answer B there, is BSL a signed form of? BSL is a language within its own right, and it is not a direct translation of English. So as if you know English, then you wouldn't automatically know BSL. If you know BSL, then you wouldn't automatically know English. And as I say, they are not a direct translation of each other. So there are some specific concepts that exist in spoken English that don't have a specific kind of interpretation in BSL, and vice versa. But you can express any idea. You can express in a spoken language, you can express in a sign language, any idea or concept that you can express in a sign language, you can express in spoken language. So it's important to make that distinction, because there are some people who do not know any English. So when we are thinking about providing possible communication, often if people can't get a BSL interpreter, then what they will do is say, oh, it's okay, on in English. But if your preferred language is BSL, then writing things down in English is going to be accessible for you, because BSL is not a translation of English, and you may not have any, or you may have very little access to English. So that's a really, really important thing for us to think about, that if people's first or preferred language is BSL, then all information should be given in BSL. So let's go through these remaining things then. So the correct answers here are that BSL is a language of expressing any abstract idea, and that it utilizes space and movement to convey meaning. Just going to think about, not many people put them as potential answers, but we're just going to think about them because there's common misconceptions here about BSL using picturages or using mime. This is incorrect. Whilst some BSL signs are what we call iconic, so that means that if you didn't know BSL, BSL, you might look at them and think, oh, I think I have an idea of what that is. The sign might look like the thing describing. Most BSL signs are not iconic. So most of them, if you didn't know language, you couldn't look at them and understand what the sign was. That's why it doesn't use picture-like images, and it also doesn't use time as well. It's important for us to be really clear about that, because people, in their haste and their want to try and be well understood by somebody who is a sign language user, they will often try and use visual gesture with the hands. If you're someone who naturally gestures and you're just gesturing naturally, that's okay. But if it's slipping into trying to imitate sign language, that can come across as quite offensive to deaf people. It's very similar to if you are trying to speak to someone who speaks French, putting on a French accent and then speaking English. By imitating somebody's language, and that can come across as very offensive. So hopefully that makes sense, and hopefully some very common misconceptions about BSL, British Sign Language, and hopefully you've got a bit more of an understanding of what BSL is and some of the nuances there. So we're going to think about now some communication skills to use when you are communicating with deaf people. So these are some do's and don'ts, and it might be really helpful things to share with some of your colleagues. So things that we should be is getting the person's attention before we start communicating with them. And it's worth thinking about how you might do. I've seen a huge range of methods of getting deaf people's attention. So often I see people kind of waving very wildly in the person's face. But the easiest way to get someone's attention is going around in front of them and their attention, or particularly if you know the person, just gently tapping them on the arm or the. If you are communicating with someone who is deaf, particularly those who are British Sign Language users, then sometimes there are other things to do to get their attention. For example, coming to a really deaf person, you could flick the lights on and off to alert someone that you're coming into the room, or you can stamp on the floor and they will feel the vibration that there is someone coming into the room. I generally wouldn't recommend doing those things with hearing people, but with deaf people, those are actually appropriate. So we want to make sure that we're supporting one's speech reading or lip reading as much as possible. So making sure that we're seeing the person that we are speaking to and trying not to turn around or move away while we're talking. I see really, really commonly what people will do is they'll be sitting facing someone and wash hands, or they'll go to get something they need, and then they'll turn, face the sink and say I'm part of their conversation or consultation while facing the sink. So it's really, really difficult to lip read people who are moving, and some of them not looking at you. So it's really important that we're always facing the person that we're speaking to. We should be speaking clearly and at a natural pace. If someone who knows that you mutter or speak very, very quickly, then try and slow yourself down. But we don't need to do this thing I see people do very often, where they really can exaggerate their lip patterns, really exaggerate their speech. Because by doing that, by shouting or exaggerating, what you will do is distort not only lip patterns, but also the sound of your speech as well, making it very difficult for the deaf person to understand you. We've talked about the importance of keeping your mouth visible, that's really important, and using natural gestures and also your natural facial expressions. So try not to cover your mouth. So think about using things like face masks. If you're using face masks when communicating with people, think about an alternative like a clear face mask or a visor. Try not to cover your mouth with your hand, or things like, I work in a hospice where we have charts, and I often see people covering their mouth with drug charts and things like that. And that's lip reading or speech reading. When you're communicating with someone, check they have understood. If they haven't understood, repeat the sentence once if necessary. Then if they still understood, then rephrase what you try not to just give up and say, oh, it doesn't matter, because it can come across as really dismissive to deaf people, and it can be quite triggering for them as well. Also, often what I see is that people will say something quite trivial with someone. A very common is when you're doing home visit and then you've met a person for the first time and you say, oh, the weather is nice, isn't it? And then they say, oh, what did you say? And you say, oh, it doesn't matter. The deaf person doesn't know that what you said is really true. They might think it's a really important thing because they haven't heard what you said. So by saying, oh, it doesn't matter, cause them to feel quite anxious because they don't know that what you've just said is quite trivial. So it's really right to say, oh, it doesn't matter. Some general communication skills, and as I said earlier, accessibility benefits everybody. And these are some general communication skills within healthcare that we should all be using that are helpful for everybody. So setting the context of a conversation is really, really important. And trying not to switch to a new topic about war. So when I'm meeting, I would say, okay, I've got a really good understanding of your pain. Now I would like to talk to you about something. I'd like to talk about nausea and vomiting. So that patients have a good understanding of the context where we are going. That's particularly helpful for deaf people, especially those who are using a lot of lip reading. So lip reading is a really helpful communication support for deaf people, but often very inaccurate. So even your very best lip reader, I'm a very good lip reader, will only get 60 to 70% of what is said through lip reading alone. And often what they will get through the lip reading fill the words, the and next, not the words will add meaning to what you are saying. So making sure someone knows the context means particular reading, because lots of things lip read in a very similar way, they can then fill in the gaps. So a common example is, would you like something to read and like something to drink? Lip read in nearly exactly. But if you knew the context of the conversation, then you could fill in that read or drink. So hopefully that makes sense. And some general things. So making sure that we are trying to turn off or move away from any background noise, particularly those of us who work in inpatient settings, often really, really busy noisy environments. And that's really important. We reduce background noise as much as possible. And this last thing there, not standing with a window or a bright light behind us, that's because that can cast our face into shadow. So thinking then about some general things about communication skills of deaf people. As I have said, speech reading or lip reading is a very difficult thing, particularly speech reading times, dates, names, places and instructions is very, very challenging. So to people to understand that, and if somebody can understand English, then writing these sorts of things down is really important. Hearing aids are useful for many, hearing aids and cochlear implants, but they're not very smart and they will amplify all background noise. So speech can often get lost. So that's why it's really important that we reduce background noise as much as possible. We want to improve individual auditory environment as much as possible. So what is if there's somebody who uses hearing aids, then we start speaking with them, and we need to make sure that their hearing aids are working, aids are in. I can't tell you the amount of people who I meet, particularly in hospital, who wear hearing aids, and they've had lots and lots of conversations with healthcare professionals. I come to meet them. I reckon with hearing, they say, oh yes, I usually wear hearing aids, but I haven't seen them in a couple of loss in A&E. So we want to make sure we are improving that person's individual auditory environment, or simple things like a person has a right-sided hearing loss, and we're communicating with them and facing, their right side is facing the wall. So that will be a really, really simple fix that will have a big impact on their communication. We know that deaf people have lots of different communication needs and preferences. Some deaf people prefer speaking, their first language will be a spoken language. Some deaf people, as I've said, will have a first language, a sign language, and if a person's first or preferred language is a sign language, then an interpreter is absolutely essential for them. It's important that we think within our settings of how we can get interpreters for presentations, but also plans. So when I admit people to my hospice in the middle of the night, knowing that I can get an interpreter at that time as well. So when we're giving information, I've talked about the communicating things like names and place instructions. If someone doesn't have access to English, then we need to make sure that those things are interpreted. For example, I have many cases of deaf people who have been given prescriptions of medication and they have taken them incorrectly because information has just been written and has not been interpreted into BSI. So hopefully these communication skills make sense, and if we can implement them, then they will have a really, really huge impact on making sure that deaf people are included and that they have accessible communication. So finally, before I summarize and we go to some questions, I'm going to think about specific things about the needs of deaf people within palliative care, where we all are based. It's important that we think about the wider needs of deaf people within healthcare settings, because that has a big impact on us, but also very specific in palliative care. So firstly, when we listen, we need to think about what the background is of their deafness. You can see that you're the first person to notice that they are deaf or have a hearing loss. It might be that they have a new hearing loss related to their disease. So there are lots of cancers which can people to lose their hearing, or it might be that the person has been deaf their whole life. And as you can imagine, that varying background will have a big impact on how the person feels about their deafness. It will also have a big impact on their communication needs and also their communication skills as well. It's really important, and it's why I always show those videos at the start with any teaching about the needs of deaf people, that were deaf people's previous healthcare experience. You can imagine there are a lot of deaf people who have had some really difficult and some really inaccessible experiences within healthcare. So often that means that deaf people present late with symptoms, and often, sadly, within palliative care, often means that deaf people present very, very late, particularly deaf people with cancer, and often they present so late that they can't have any curative treatment. And
Sorry, Natasha. Sorry, Natasha. They present what?
They present late. Deaf people presenting late to healthcare settings.
What's the word?
Yeah. Late. Late.
Thank you.
Yeah, that's all right.
Thank you, everyone.
That's all right. So often deaf people present late to healthcare settings because they either don't understand what their symptoms are and why they need to attend healthcare settings. They feel too worried because of difficult experiences. So it's really important that we are aware of that. It's also important for us to understand within the deaf community, there is a very mixed cultural understanding of dying and of palliative care itself. So something to think about, particularly when you're communicating with people who are sign language users, is that there might be a different understanding of what death, dying, palliative cases are. So an example of this is I was giving some recent teaching about advanced care preferences with deaf people. And when the interpreter was signing hospice, I noticed that the interpreter was actually signing was dying hospital. And actually, the understanding of all of the people there, because that was the main sign that they had seen for, they thought that hospices were places that people just die. So it's really important that we as professionals, when we are working with interpreters particularly, think about their understanding of what hospice and palliative care are, and that we prepare them for those sorts of conversations. And there's a real cultural variance in the understanding of dying and hospices and palliative care. It's also really important, as I talked about earlier, that we're inclusive in our verbal communication, that we understand that everybody has different needs when it comes to their verbal communication. Within the community, there are some people who rely more on speech reading, some people who use other assistive technology, and we need to make sure that we're considering all of that. And my final point that we must consider within palliative care settings is what I call deaf advanced care preferences. So lots of us will be involved in having conversations with people about their advanced care preferences, but we need to think specifically for deaf people what those are. So simple examples like, as you become less well, you become more sleepy and you are not able to communicate your communication preferences more actively, then would you want your hearing aids kept in, for example? Or would you prefer that when you are more sleepy that your hearing aids are out? Or what sort of language preferences you have at that time? So it's important that we understand those things early and that we ask those things to deaf people early while they're able to communicate to us. So these are just some different resources, and I will put some of these in the chat as well so that you can share them, which are different things you can go on to look at, because this is just, like I said, scratch the surface in what is such an important topic. So IDA is my organisation, and we do lots of different insight teaching and helping people to understand the needs of deaf people within their setting. The Royal College of GPs has done a lot of work with us about deafness and how they can make generally practicable. There's some evidence from Cochrane about some of the good, not good things about hearing aids. We know that the NHS Accessible Information Standard also has hospices and community palliative care services, and this says that everyone with communication support needs is entitled to accessible information. I've written some pieces, covered it very much due to the confines of today's session, about what it's like to work as a deaf doctor, and then some other pieces from other deaf people about their interaction with healthcare. Sign Health is a charity which does a lot of work around deaf access within healthcare. And then the Sign Bank is almost like an online dictionary where you can find some different signs, and that was created at. And these are my contacts if you'd like to just take those down, if you've got any questions that you would like to ask me after. So just looking at the time, we've got it, so I'm going to stop sharing, and I'm just going to have a look at the questions. So I'm just going to pull these up. Okay, so I'm just going to start at the top, and I will read the question out. So this question says, gesture is important. So sorry, I'm just going to read first. What this person is saying is that gesture is important, like when you're trying to communicate with a non-English speaker, they will use facial expression and body language to communicate, and people should do the same. So I agree with you that using natural gesture, facial expression, body language is a really important part of communication. But the distinction is that we don't want to be imitating sign language, because that is an offensive thing to do, and can be very offensive to deaf people, as I explained. Thank you. Great, thank you. And somebody is thanking me for the presentation and saying that they think it will be a really important thing to share more widely, particularly with deaf service users. So I wonder if anyone else has any questions about how this might look in practice, or indeed has any reflections on any perhaps difficult cases that they've had with deaf people, for example, and we can discuss those.
There's not many questions in the chat yet, Natasha, but there's been quite a lot of lovely reflections from people saying how useful this talk has been, and also people just sharing their own experience. So someone called Ruth has said that their parents are deaf, and they won't go straight to their GP. They will usually wait for herself or her sister to visit them. Mainly because of the lack of support and communication with the GP surgery. And she says there's also a lot of guilt they have with asking their children to support them, and they're so fearful of not being understood. So thank you so much, Ruth, for sharing that. And I think, yeah, that really echoes what Natasha was saying in her presentation. So thank you for that.
Yeah, that's really, thank you. That's a really helpful reflection, and a really common thing that a lot of deaf people say, that they feel guilty for asking family members to interpret, but often, sadly, it's extremely difficult for them to be able to access interpreters, particularly for what we call unplanned encounters. So, for example, going to A&E or an emergency GP appointment, something like that. And that's really a really difficult thing. But within the accessible information standard, all healthcare professionals should, and all healthcare settings should be providing BSL interpreters to people for planned and unplanned encounters. So really worth reflecting on your own services and thinking about how you would provide BSL interpreters for both those planned and unplanned encounters.
Sorry, I was just going to say we've got one more question. I don't know if you want to read it out. It's from
yeah. Thank you. So we've got a question from Rahul which says, do you think that basic sign language training should be part of all specialist care, or do you envisage a set of specialists dedicated to the needs of the deaf? Thank you, Rahul. That's a really interesting question. I think there are a couple of areas here. I think that it should be essential that everyone working in healthcare has some deaf insight training, because we know that there are 1 in 4 adults in the UK who are deaf, who have hearing loss. And it's really important that everyone has skills to be able to interact with them. Also because often those people are undiagnosed or unrecognised, so they are presenting to mainstream services. But I think that it is very helpful, particularly for deaf people who are sign language users, who are a much smaller part of that group, but a very important part of the group and who are often underserved within healthcare settings, to make sure that they have a specialist set of services, or at least that people within generic services know how to access specialist deaf care. So, for example, the hospice that I work in, we have created a kind of specialist service for deaf people who are British Sign Language users, and that means that all of our local services know to refer into us as well. So I think both. I think everybody should have access to a level of Deaf Insight training. I think everybody should have access to some at least introduction to British Sign Language, so that they could introduce themselves to a sign language user, or could ask some basic questions. I think that's really important. But then, because there is so much nuance within the deaf community, I think it's helpful to have highly specialist services as well. Thank you. We've got somebody else who is working on the accessible information standard, and I will definitely contact you about that. Thank you. That's really good to know. And someone who is saying, I have a young man on my caseload who is deaf and blind, and they found this information useful, and they can improve their healthcare passport. So that's really good, yeah, to think about how we communicate people's communication needs across services. We know within palliative care, we are often a service which coordinates people's healthcare. So we're often the people communicating with the GP and communicating with other services. So it's really good to think about how we share people's communication needs through health passports or other things. Right, thank you. Very happy to take other questions. Here we go. So yes, so this, you're very right. So there's a question which says, deaf awareness training can be useful too. Absolutely. So having deaf insight awareness training, and also having some British Sign Language training as well, I think would be a really useful thing. Thank you. I'm happy to take any other questions. Sorry, I know Luke and Izzy are working hard in the background, pulling the questions across.
There's not any other questions, but again, lots of people just praising this talk and saying how useful it's been and how they'll apply it to their own work, and quite a lot of emojis popping up on my screen currently of hearts and the little brain. So it's clearly been really informative for people. Thank you, Natasha.
Great. Well, we'll give it a couple more minutes if there are any other questions people have, but otherwise, thank you so much for your engagement and your thoughts, and I can see there's lots of reflection in the chat. Like I say, if you've got any questions, I will put my email in the chat now, so that you can contact me, and if there are kind of particular cases where you want to talk through things, or you're doing a project about accessibility or communication, then very happy to get involved with that. So I've just popped my email in the chat there.
Thank you, Natasha, and thank you, Christine, as well. That was an excellent presentation. So we will, if anyone would like this presentation to watch back at another time, it will be available on our platform. On the homepage, if you scroll down, it will be on the on-demand section, and that usually takes a few hours to load. Alternatively, if you would like to be sent a copy of the presentation, you can email the Marie Curie team, and we can send that out to you. I know a few people in the chat said that they would find that really useful to kind of cascade it to their colleagues and so on who might not be coming to this conference. So yeah, we can put you in touch with Natasha as well. So I'll just put that email address in there as well. But yeah, Natasha has shared her own, so feel free to contact her directly. Thank you.
Great. Thank you so much. Thank you, everyone.